Dental amalgams are dental filling material used to fill cavities caused by tooth decay. It has been used for more than 150 years in hundreds of millions of patients around the world. Dental amalgams are a mixture of metals consisting of liquid mercury and a powdered alloy composed of silver, tin, and copper. Approximately 50% of dental amalgam is elemental mercury by weight. The chemical properties of elemental mercury allow it to react with and bind together with silver, copper, and tin alloy particles to form an amalgam. Manufacturers supply the materials to make an amalgam in a sealed capsule with two compartments. One side contains liquid mercury, and the other side holds a mixture of alloy as a powder or tablet. The capsule can be placed in a machine that breaks the membrane between the two compartments. When placing a dental amalgam, the dentist first drills the tooth to remove the decay, and then shapes the tooth cavity for placement of the amalgam filling. Next, under appropriate safety conditions, the dentist mixes the powder alloy with the liquid mercury to form an amalgam paste. This softened amalgam paste is placed and shaped in the prepared cavity, where it rapidly hardens into a solid filling.
Hello everyone, we're here at Violin Dental with Dr. O. We're going to ask him a few questions about amalgams.
Okay, amalgam has silver about 40% and tin 31%, copper about 30%, and mercury. Don't make it is come with in capsule pre-measured, so it's pretty safe, exact portion. In the amalgam mixer,
Okay.
and then amalgam mixer does everything. It's very reliable and long-term, using about 100 years already they are using it. And the other advantage is the short time working time, working time.
Okay.
Because of the mercury, um, uh, American Dental Association recommend to adult patient for now, because they're still studying the effect of the mercury in pedo patients and pregnant women. So they still are studying about it. Uh, Actually, we are using some cases, but we try to use the a white filling.
For children?
Yeah.
Okay.
After 1 week, we try to have a appointment for the polishing, and that's it. And every 6 months we check up. Usually we do.
Currently, most attention is focused on direct restorative materials, such as composites, glass ionomer cement, compomers, geomers, and sealants, and less on indirect materials, such as dental porcelain. The reason is that the use of indirect materials is costly and time-consuming in terms of procedure, even though these materials show excellent biocompatibility properties and durability, particularly a high resistance to wear and distortion. Glass ionomer cements bind to dental hard tissues. Geomers have been recently introduced and feature the hybridization of glass ionomer and composite resins. They contain an adhesive promoting monomer and a bonding polymer catalyst, which allow bonding to hard tooth tissues. Compomers combine some of the benefits of composites and glass ionomer cements. However, compomers do not bond to hard dental tissue. Sealants are flowable resins and high viscous glass ionomers that are applied to seal pits and fissures in permanent teeth in order to prevent the occurrence of dental decay. The problem with these alternatives are that they contain a complex mixture of chemicals that react with each other inside the tooth cavity and also interact with the surrounding tissues. Some of the components of these materials are highly toxic to gum and pulp cells grown in the laboratory, and others can cause mutations.